Keeley. I'm a student physical therapist assistant. Can you tell me your first and last name and your date of birth?
August 21st, 15.
Okay. Can I see your wristband? Alrighty. Alright, Mr. Tiemann, what I'm doing in here today is we're going to be working on some exercise. I got you on this bike. We're doing this just to work on your endurance, but while we do that, I'm going to be taking your vital signs. Because of your recent motor vehicle accident, your endurance has been a little weak, and your PT wants me to check on your vitals as we do, so that's kind of what we're going to be doing today. I'm going to have you on this bike for 3 minutes. I'm going to check your vital signs before we start, in the middle of it, after, and then 5 minutes after, okay? So, what you can do for me is just let me know if you ever feel dizzy, if you feel faint, if you just feel like queasy or anything like that, just let me know. Before we get started, do you have any fractures I should be aware about? Any open wounds? Do you get nauseous usually when you're pedaling or working out? Okay. Have you seen any other therapies today? Alright, well, do I have your permission to go ahead and get started? Alright, first thing I'm going to do is I'm going to get your pulse ox, heart rate, and respiratory rate. Go and put that on your lap. Alright, for respiratory rate, I got 12. For heart rate, I got 81. And respiratory, or pulse ox, I mean, I got 98%. Alright, get that off of you. Now I'm just going to take your blood pressure. How are you feeling?
Fine.
Go ahead and pull up your sleeve a little for me. And relax your arm. Make sure your legs aren't crossed. Put that right there for a second. Alright, I got 122/78. So that's good. Put that off for you. Sorry. Alrighty. So I'm going to go ahead and document that. So I'm checking, before we get started, I'm checking for any distress of respiratory problems, any blueness, are you dizzy at all? Okay, I don't see any signs of shortness of breath, so let's go ahead and get started. So what you're going to do is you're going to bike for me for about 3 minutes, okay? I'll go ahead and set a timer for you, 1 second. Alright, go ahead and start. In about 1.5 minutes, I'm going to be taking your vitals. Feeling okay? Alright, about 1 minute and 10 seconds left until I take them again. Alright, as we're going, I'm making sure I don't see any signs of distress. I'm not seeing any blueness or shortness of breath that are concerning. He doesn't seem dizzy. More seconds. Feeling okay?
Mm-hmm.
Seconds. Alright, so we're halfway, so I'm going to get your finger. Keep going.
Oh.
Keep going. Don't stop. Just hold that out for me. Alright, so definitely an increase in heart rate. We got 113. Pulse ox is 97. Looking good. About 50 seconds. Alright, go ahead and stop for me. Put this back on here. I got respiratory rate of 18. I got heart rate of 96. So that went down. It's good. And I got pulse ox of 98. Gonna go and take your blood pressure. You feeling okay?
Mm-hmm.
I'm not seeing any signs of respiratory distress. So that's good. And look here. You can relax it a little bit for me. There you go. I got 125 over 80. Didn't spike too much, but it did get a little bit. Alright, so I already took account of respiratory distress. I'm not seeing any. So now I'm going to have him sit here for about 5 minutes and then I'm going to retake his vitals.
Action.
Alright, so it's been 5 minutes resting. Let's go ahead and take your vitals again. You feeling okay?
Yeah.
Alright. Breathe. respiratory rate, I got 14. So that's a significant decrease. Heart rate got 88.
Yeah.
And then oxygen got 97. So decreases all around. Get that off your finger. Let's just take that blood pressure.
Stacy.
That's Rose.
Arm hurts.
Your arm hurts?
No.
Relax. Alright, I got 119 over 78, so a significant decrease there. Alrighty, sir, how you feeling?
Fine.
Alright, I'm taking note of his respiratory distress. I'm not seeing any, no blue lips, fingers. You feel dizzy at all?
Mm-mm.
Alright, good. Alright, well that's all for me. Are you in any pain?
Mm-mm.
Alright. Well, I'm going to go document what we did today. I'm going to tell my supervising PT that you had no adverse effects and that I saw a good decrease in your vitals and a spike where it needed to spike and a decrease where it needed to. I've noted that your vitals went up during the workout and it went down afterwards, so that's really good. I'm going to go document that. Alright, so if you don't have any questions for me, I'm going to leave you in a comfortable position. I would not leave him in of course, the equipment, but for this sake I will just pretend he's in a comfortable chair. The chair is locked in position. Here's a call light. Bed rolls, lower bed, but you know, we're in a chair. Alright, well I'm going to go clean my supplies and I'm going to go wash my hands. If you don't have any questions for me, I'm going to exit the room. Alright, I'm going to go clean my supplies.